Good afternoon and welcome to the City of Toronto's COVID-19 media briefing for Wednesday, January the 13th, 2021. Joining us today is Mayor John Tory, Toronto's Medical Officer of Health, Dr. Eileen de Villa, and Toronto Fire Chief, and the General Manager of the Office of Emergency Management, Matthew Pegg. Mayor Tory?
Well, good afternoon and thank you, Brad. We are now hours away from the Government of Ontario's stay-at-home order coming into effect. And I want to again thank Premier Ford for taking this action. In the face of rising case counts and hospitalizations and tragically deaths, this is going to help us stop the spread of this virus, save lives, and protect our healthcare system. This action was needed. I also want to thank Minister Steve Clark for stating clearly last night that the province will be freezing residential evictions with an emergency order. This, too, is the right thing to do for tenants in the province of Ontario. Our city staff and Toronto Police are continuing to review the provincial changes announced yesterday. We have asked the province for greater clarity around a number of aspects of these initiatives, including the intent and the details of the stay-at-home order itself. I spoke to Police Chief Raymer earlier today, and he is also seeking clarity around the enforcement aspects of these new arrangements. We're all working to make sure that our residents have as much clarity and consistency as possible, and we will convey as much information as we can as soon as it has been confirmed. But right now, one thing is crystal clear, and we really should focus on this more than anything because it is simple and it is clear. Please, people, absolutely stay home as much as you possibly can. That is the fundamental message. Please stay home. This is to keep you from contracting COVID-19. This is to keep you from bringing the virus home to your loved ones. This is to keep you from getting sick, having life-changing complications, and to keep you from dying, heaven forbid. There is a deadly virus in our city, and the number of people with that deadly virus is on the rise. If there's any doubt after you hear all about the rules and the orders and everything else, always default to staying home whenever you possibly can. Over the coming weeks, it'll be a long time, but stay home anytime that you're in any doubt whatsoever. This will help stop the spread of the virus, this will help to save lives, and it will help to protect the healthcare system so that it can protect people both who are ill from COVID-19, but also those who are experiencing heart ailments or strokes or cancer treatments that they need. I am trying to be as direct and as clear as I can be. This is a life-saving message we simply must take heart, all of us take to heart, all of us, all the time. Please stay home. And on that note, I'll ask Dr. de Villa to deliver her report for today.
Thank you, Mayor Tory, and good afternoon. Today, I am reporting 789 cases of COVID-19. 421 people are in hospital, and 108 are in ICU. I regret to tell you 23 more people have died. In the last week, the 7 days since January the 7th, we've reported 7,408 cases of COVID, 289 hospitalizations, and 111 deaths. Staying at home as much as possible for the next 28 days is absolutely necessary. It's critical to create greater barriers between ourselves and the virus and to protect the healthcare system, which we all know now is under great pressure. Distance is the single most important barrier. The provincial stay-at-home order allows for going to the grocery store or pharmacy, accessing healthcare services, and leaving home for exercise or for essential work. Please stay home unless you've got an absolutely necessary reason to go out. Morale is enormously important right now. Our ability to believe that there are better days ahead will likely be severely tested in the next month and maybe even longer. If the projections from the province manifest in the worst case, we should prepare for what that will mean here in Toronto, as we are the country's largest city, home to high density and some neighborhoods at highest risk. In that instance, a significant number of higher case counts, hospitalizations, and deaths would be right here in Toronto. As difficult as the next several weeks may be, in the end, the hard times will pass. The pandemic will end, and better times will emerge. There is a lot we don't know right now, but there are many things we do know, and they are powerful, familiar, and simple. Wear your mask. See only the people you live with. For now, put off meeting with people you don't live with. Keep a safe distance. It works. Wash your hands. If you're sick, stay home. If you think you might be sick, stay home. Most of all, come what may in the next few weeks, remember that better days will come. I'll now turn it over to Chief Pegg to deliver his remarks for today.
Thank you, Dr. de Villa, and good afternoon. As indicated by Mayor Tory, the city is seeking clarity on a number of fronts, including the details with respect to enforcement of the regulations by our coordinated enforcement team. As you know, our coordinated enforcement team includes Toronto Police, City Bylaw Enforcement Officers, and Toronto Public Health Inspectors. As soon as we have clarity from the province on these issues, we will communicate clearly as to how our coordinated enforcement team will respond to and enforce these new provincial orders. I want to thank city staff, including all of those who are tasked with enforcing provincial orders, for all the work they do each day. This is complicated and challenging work, but also important work that helps to protect public health and safety. The city's website will be updated as soon as we receive clarity on the application of the orders announced by the province yesterday. I remind you that toronto.ca/COVID-19 remains the best and most credible source of information for both city residents and businesses. Thank you.
Thank you, Chief. Before we go to questions, just a reminder to reporters that you will need to unmute yourself. Go ahead, Matt Bingley from Global News. You're up first.
Hi, good afternoon. Mayor Tory, just a few moments ago, the Premier accused local officials of being irresponsible for being confused by these directives. Both you and Chief Pegg have both said that there needs to be more clarity. Earlier today, the province put out an FAQ that seemed to not really understand the meaning of essential itself. I'm just wondering, how do you address this? How quickly do you need to find out that clarity? And to Dr. de Villa, when there is an absence in clarity, is it not up to the medical officer of health to make or address these gaps, especially when there are contradictions like with big box stores?
Well, I'll start off by saying that I think that the one thing we need to do is make sure people understand a message that's been clear for a long time, and it is a message that has been there through different rules and lockdowns and orders and different things, which is please stay home. And I hope if people take nothing away from the events of the last couple of days, other than to say we have a crisis in our healthcare system, it is taking lives and getting people sick, and it is necessary for them to stay home more than they have been. That would be what would be most important. But having said that, I think that obviously, more so than on the medical people, there is an onus on those who make rules, including us when we make them, to make sure that they're clear and consistent. And I think it would be advantageous if we had rules that were clear and consistent across the region and across the province. And that just requires some further clarification on a matter that has proven to be very complicated, because it is. But I'm still working very well with Premier Ford. I think the steps he took yesterday were positive steps to help us to fight the virus. And all we're trying to do now now is to make sure that we have all the answers in hand to allow us at our, place in all of this to make the right decisions to make sure that we make the steps taken yesterday by Mr. Ford the most effective they can be.
So to add to that answer and to answer the question directly, Matt, I would say this. I'll reserve any judgment in respect of what clarity might be required once we have the opportunity to see the regulations. But I do think that any step that is taken to increase distance between people, any step that takes us closer towards reducing the spread of COVID-19 in the community is a step in the right direction. So I do think that that's fundamentally what we're looking at here. I would also say this, it is patently clear that the message is to stay home as much as possible, because that's about keeping distance to the greatest extent possible. It's been said many times, it is familiar, but it is incredibly powerful. Stay home as much as possible. Only go out when you absolutely have to. When you are out and about, wear your mask as much as possible. Wash your hands when you get home. And if you're sick, stay home.
Follow up, Matt? Matt Bingley, you there?
And to follow up,
Go ahead, Matt.
hi, can you hear me? WebEx is just acting up.
That's better. Go ahead. Try now.
Okay, hi, sorry. To follow up with you, Dr. de Villa, you have spoken about the importance of going outside for exercise and mental health, but when you have this stay-at-home order, the Premier repeatedly saying, stay home, stay home, stay home, you saying, stay home, stay home, stay home, when it comes to that with city ice rinks and toboggan hills being open, is that not a contradiction to trying to tell people to stay home when they could say, it's essential, I've got ice skates in my hand?
Well, Matt, I think that waiting yet to see the specific regulations, so would be very interested in actually having that opportunity to review them. But I think we recognize that the decisions that are taken are meant to try to provide this balance. And it's my understanding that what is provided for does allow for such things as exercise. And we know how critical exercise is to overall health and well-being. So absolutely, the notion is to do the best we can to reduce the spread of COVID-19 throughout the city. Staying home to the greatest extent possible is obviously a part of that. But we're trying to preserve health. I think this is an effort across all levels of government, that health is more than just about COVID-19, and exercise and getting outdoors is part of that. So I think this is just a reflection of trying to strike that appropriate balance, as has been the case throughout the entire pandemic.
Thank you. We'll go next to Mark McAllister from City News. Mark, go ahead, please.
Dr. de Villa, is this a time for balance, though, when we've got as many cases as we do and you want people to stay at home? Why would you and the city allow people to gather on ice rinks and on toboggan hills when you don't want people to gather in the first place?
Well, Mark, I would say this. I think there are some essential activities that are part of life. And for example, we know that there are essential workers that need to be out there so that we actually have the goods and services that we require on a daily basis. We all need to get some exercise. We need some opportunity to ensure that we're maintaining both our physical health and our mental health, not only protecting ourselves from COVID-19. So once we have the opportunity to take a look at those regulations, I'll be able to comment better. But I would say to people that the measures for self-protection are still the measures for self-protection. You've heard me say them time and time again, and I can't say them enough. They continue to be the most important thing that each and every one of us can do to help reduce the spread of COVID-19 and to help reduce that pressure that we're currently seeing on our healthcare system. So please, right, it's about staying home as much as possible, limiting interactions with people to the greatest extent possible. Yes, making sure that when you do have to go outside, because yes, there are those essential activities, do wear your mask to the greatest extent possible. And of course, if you're sick, stay home. These are things that each and every one of us can reflect in our daily lives, and I think things that will help us overall in our fight against COVID-19.
I'll ask this to you, Dr. de Villa, as well as Mayor Tory. You have a sense at this point of what has been said and hasn't been said by the province. Yes, you're seeking clarity, but you must be considering some things that you can do on a local level as well. Aside from parks and playgrounds and ice rinks, are there other things? For instance, in the spring, we saw that off-leash areas for dogs were closed. Are there other things that can be done to make sure people don't congregate?
Well, you know, I think that from where I sit, not having yet had the opportunity to look at the regulations, once we have the chance to take a look at them, we'll be in a better position to comment on, you know, what further might be done. But I would suggest this. I think at this point, any step that is taken to reduce distance between people, any step that's taken to reduce the spread of COVID-19 is absolutely a step in the right direction. And many of those steps are actually in each of our hands right now. So I would again encourage people to the greatest extent possible, please stay home as much as you can. We know that our healthcare system is under incredible pressure, and we can do a lot to help make sure that we're reducing that pressure, to ensure that healthcare is there for all of us who need it, whether it's for COVID-19 or for any other medical issue. I think that, again, a lot rests in our hands, and we know that the people of Toronto have been successful at doing this before, and I have every confidence that they can do it again, as hard as it is.
Okay, thank you. We'll go next to Haley Cooper from News Talk 1010. Haley, go ahead, please.
Thanks so much. And just before I ask my two questions, if we could just get some clarification on something, please. We're talking about skating rinks, and Mayor Tory, you said this morning that you hope to be able to announce what's happening with skating rinks, if they'll be allowed to stay open or closed. So if we could just get some clarification on whether that is official, that the skating rinks are going to be allowed to stay open.
Well, I think, as you've heard Dr. de Villa say on a number of fronts today, and it's correct, I thought that when I said we'd be able to address it this afternoon, we would have seen the regulations by now, which we have not. And so if you look at the current situation, the deck put out by the province yesterday indicates that skating rinks can be open. But then there's a stay-at-home order that has been, we haven't seen the wording of that yet. And then there's furthermore some restrictions that are placed on the size of groups and how that might be defined. And so there's all these things that kind of come together, which is all I've been saying in the context of needing some clarity before we can then sit down and have the discussion that Dr. de Villa was just alluding to in the context of how skating rinks fit in to all of that and to the need for people to have places to go outside and get exercise. So once we've seen the regulations, we will have that discussion, and I think they're supposed to come out maybe later today, and we'll then be in a position to have that discussion and to let you know what's been decided.
Okay, thanks for that clarification. So my first question is, when do you expect to get clarity on the police enforcement aspect of this stay-at-home order? The legal text is expected to be published tonight. Will you all be learning at the same time that we all learn once that legal text is published? And what advice is being given to people who do need to leave their home from work? Should they be carrying perhaps an official note from their employer at all times?
I'll start, and then we can always hand off to a Toronto Police colleague on the line. So in order to even begin to understand those things, and in order for us to plan appropriately, and frankly, in order for our Toronto police officers to understand the full extent and the application of the law in order to even commence with any type of enforcement or response plan, as you've heard Mayor Tory and Dr. de Villa say, we need to see the actual regulations. And the regulations, of course, contain and represent the formal technical language and detail out all of the amended provisions of law. So until such time as we see those regulations, and a number of professionals can review that, including, of course, legal services, and in the case of Toronto Police, the Toronto Police Service, we simply don't know the answer to those to the questions you've asked. So, of course, and accordingly, We will not, none of our coordinated enforcement team will commence any type of enforcement related to what we believe or what we understand to be the situation until such time as we've seen the regulations, they've been assessed, fully evaluated by our enforcement teams, and then we can move forward. I know, Brad, I know we have Deputy Demke
We
on
do.
the line.
Deputy Demke, do you have anything to add to that, please?
Yeah, if I may, thank you so much. And it is a very important issue for us in policing. We are too waiting the regulation, as we've all heard, but we'll be taking additional steps when the regulation is made available to speak to members of the Ontario Association of Chiefs of Police, other chiefs from across the province, where we'll collaborate together, as well as with our city partners. As you heard, it is very much a coordinated effort between ourselves, bylaw, and public health. And we'll work with our coordinated team in Toronto, and indeed we'll be liaising and coordinating. We're having discussions with chiefs of police from across Ontario and the province as well. Thank you.
Okay, Haley, you have a final question?
Yep, thanks so much. And this question is for Mayor Tory and Dr. de Villa, if you want to weigh in as well. But we've been hearing for the past 11 months the same message over and over again about how dangerous this virus is getting, how serious it is, and it just doesn't seem to be resonating with a lot of people. And I appreciate and I respect how frustrating that must be for both of you. But are there any other ideas on getting this message out there and somehow getting it to really resonate with people? Stay home unless absolutely necessary.
It is frustrating, and without making any light of this at all, I've had people suggest that if I put an F-bomb in the middle of the sentence saying "stay home," that this would maybe get people's attention, because it's a very simple message, really. That unless people have extraordinary reasons, such as the absolute need to go to work, like our frontline health workers and people who drive the subway and bus vehicles for us and so on, that everybody should be working from home. And that's now actually a legal requirement if you can. So the simplicity of it is actually obvious. So to me, it is more that people have lost a certain sense of fear, I think, that they had of the unknown and of the virus in the spring, and now they rationalize it. They say, well, I really more or less did stay home except for the time I went here, or I didn't socialize with anybody outside my home except I just had my 2 cousins over. And this is part of the problem we have. And so I don't know. What else we could do except to try to be consistent, to try to make sure that the rules are clear for people so that they know what the rules are, besides the fundamental rule, which is please stay home. I mean, if everybody just did that, then actually much of the rest of this wouldn't matter very much.
I think the only thing that I can add further to that is that, for me, what I do is I think about all the people who've been directly impacted by this virus. And yes, many people have gotten sick and recovered without difficulty. But there have been many who continue to have symptoms long after their infection first started. And we've lost many members of our community. And these were, family members and friends and colleagues of all of us here in the city. So, to my mind, if we can put the human face on it again, so people appreciate and understand, the lives that have been impacted, the lives lost, and of course the impact on our healthcare system, which is a very, very real thing. There are many of us who require our healthcare services, whether it's for COVID-19 or for other medical conditions. And then there are the family members and loved ones who are in hospital right now. And it is extremely challenging, under the current circumstances and the pressures that are currently being experienced within the healthcare system. These are very, very real. So, I would encourage people to look at the stories, to hear the stories of their family members, their friends, their neighbors, all around the city, to appreciate that this, while the fear may not be there as it was in the spring, it is still a very, very real disease with very real and serious circumstances for many, many people. And I think that's perhaps one piece that I would encourage people to reflect on.
Could I just add one thing to that? It was just a story or a situation that, someone brought to my attention in the last 24 hours, and I just think maybe we have to have more of these stories understood by people. But it was a member of the staff here at City Hall who sent me a message late last night saying that her mother was in long-term care and that they had phoned to say that she had COVID, she'd had it for a while, and that she just was losing the battle. And then I got an email at 4:40 in the morning, and she said her mother had passed away overnight, and she sent me a picture because she'd been called over, and the picture was of the daughter looking in the window from outside at her mother lying in bed just before she passed away. And I think these are the kinds of things that I think until we have somebody like that we all know, and there are example after example after example of that, and they're not all older people, they're younger people too. Dr. de Villa reports on the young people that are in hospital, sometimes with life-threatening illnesses. They wouldn't be in hospital if they weren't. Sometimes where the only way out is going to be for a lung transplant. Sometimes in a situation where they might face lifelong health complications at age 30 from having COVID-19. And I think people think this is like a cold or it's like the flu, and you just get over it in a couple of days and everybody goes back to normal. And I don't know, short of bringing some of these people out to these, maybe we should bring them out and they should sit here instead of us and tell their stories, because it is a small group of people that haven't got the message. We've seen some data today from the phones again that show that actually over the Christmas holiday period, and you'd expect it to be quieter, more people were apparently staying home based on the inactivity of their phone, moving around. But there were still tens of thousands of people after months of being asked to stay home who went shopping before Christmas when the lockdown rules were uneven. And so I don't know. It's very, very frustrating.
All right, thank you, Mayor. We'll go next to Francine Copen from the Toronto Star. Francine?
Good afternoon. I understand that you don't know the finer points of the regulations because you haven't seen them, but what's your best understanding? Have police and bylaw officers been given additional powers to enforce the provincial orders issued Tuesday?
Hi, Francine, it's Chief Pegg. The reality is we don't know. So literally the best information we have right now comes off a media release and a slide deck, and it simply is not the technical detail that we need in order to assess or understand that. When the province, when anyone, but in this case, when the province is talking about expanding authorities and expanding powers and procedures to, in this case, enforcement officials, those are very, very important, very fine, very technical details that need to be understood such that we can plan appropriately, such that we can train our people appropriately if there are new procedures or new authorities, and such that we can take balanced and appropriate response and action in the circumstances. So we are sitting right now in a position where we have not seen, we've not even seen a draft of the regulations. So we've not seen the regs. We need the regulations so that they can be understood, and you have accurately identified one of those key issues. What are the authorities? Who holds them? How are they to be exercised? By whom? When? All of those types of circumstances, and until such time as we see the regulations, we simply won't know.
I won't presume to speak for my colleagues here or for anybody at the city, except to say that by asking these questions, we're just trying to be responsible, because we're also trying to be 100% supportive of the effort to wage war on this virus. That's the enemy, and that's where our focus is, but we have to know the details, and the regulation will come out. It isn't yet. I understand it takes time to prepare these regulations and to get them just right, because a million questions come up. I'm a lawyer. I've worked in government. But at the end of the day, that's why you have to ask these questions, to make sure they get answered by the regulations so that we can answer your questions and so the public will know, and the police officers and bylaw people. It is that kind of clarity that is necessary to be responsible, which is what we're trying to be. But we're very supportive of the direction that is we're going in here, which starts with staying home, and then it goes into some of the detail afterwards for those who absolutely can't stay home.
My next question is from Mayor Tory. Mayor Tory, is the city considering perhaps hiring more bylaw officers at this time?
Doing what?
Is the city considering perhaps hiring more bylaw officers at this time, given all these new regulations?
Well, the assumption is in that kind of suggestion, which may well be the case down the road, but that you could put a bylaw officer on the street to be carrying out all of the complex tasks they carry out, because bylaw officers by definition have to know a lot about a lot of things, because they enforce a myriad of different kinds of regulations, whether it's the ones to do with other aspects of public health and many others. And so there is not a present contemplation of doing anything in that regard in direct response to the pandemic, simply because you couldn't get them trained and on the street and doing their job properly in the period of time I hope we have, meaning that I hope this is starting to come to an end, almost before that training period would be over. But we're constantly reassessing what the needs are, whether it's the police service, the fire service, the paramedics, the bylaw officers, to have these people adequately staffed so they can do their job properly.
Thank you. We'll go next to Sean Lafong from CTV News. Sean, go ahead.
Hi, this question's for Dr. de Villa. Just because we're about to start the NHL season and we are also going into the stay-at-home order, I was wondering if any second thought was given to any the approval at all of having the Toronto Maple Leafs play and host teams from other provinces.
So when it came to the NHL and its protocols, these were protocols that were actually very thoroughly reviewed by all three levels of government, and not just in this province, as the teams are from across different provinces as well. So I can assure you that those protocols were very, very carefully looked at. They were approved by all three levels of government, and they are quite rigorous, the protocols that are in place, in order to protect the health and safety of all those involved in the game and the staff around them. But most importantly, from the perspective of public health officials, to ensure that the health and safety of the broader public is best respected and protected.
My follow-up concerns that staff you mentioned. Was there any idea or second thought or even second questioning given to protecting staff in this situation, not necessarily the players who I know are tested constantly?
So, I can't speak to the finest detail of all those regulations, but I do know that the team at Toronto Public Health very thoroughly reviewed the protocols. And as I mentioned, the provincial and federal public health authorities were also engaged as part of that review. And those reviews went beyond this particular province. So they've been quite studied and certainly very carefully looked at in every aspect, with the fundamental premise being, are we doing the best we can to protect the public's health? And while this activity is ongoing, and I'm satisfied and assured that all three levels of government across the country saw fit to approve those regulations and were satisfied that all aspects were covered.
Thank you. We'll go next to Scott Lightfoot from CTV News. Go ahead, Scott.
Thanks, Brad. Question for Chief Pegg, and I appreciate the ridiculousness that no one at the city level, including the people who are supposed to enforce the act, know the specifics, but the act still comes into effect at midnight. So what happens at 12:01 today? How does this get enforced? And do you suggest there will be some sort of grace period while people sort of figure out what's going on?
So fair questions, and those are specifically some of the questions that remain outstanding. So I can tell you that we convened our team yesterday afternoon immediately following the announcement by the information or initial information from the province. Had further conversations with a number of our teams today. But like we've said, until we see the regulations, until they can be accurately and thoroughly assessed by legal services, by our municipal law enforcement teams, our Toronto Public Health inspection teams, and of course our Toronto Police Service. Until those things happen, so we can understand them, we understand what, if any, authorities are changed, what, if any, provisions are changed. We need that information in order to be able to respond. So regardless somewhat of the time, until such time as we receive the regulations, we can complete those efforts and put process in place, we will have no choice but to wait. So as Mayor Tory's indicated, we do understand. It is also my understanding that we are to receive those regulations later this afternoon. We will, of course, work at what is often described at this table as wartime speed. We will work diligently to review those regulations and to get our processes in place. And of course, our principal goal would be, as always, to be in place on or before the applicable deadlines, but that's entirely contingent upon the arrival time of the regulations to us.
Thanks, Chief. And a question for the mayor, and again, I understand you don't know the specifics, but are you expecting that the city will have to make changes to initial municipal or current municipal guidelines, whether it's, we've talked about outdoor facilities or even specific businesses in terms of things that will have to be closed in order to ensure that both the city and the public are compliant with this new act?
I wish I could give you a clear answer, and this is why I'm seeking some clarity on a number of these things and why we need to see the regulations, because obviously, what those are, both in the word and in the spirit, in terms of our review of them, will determine the answers to those kinds of questions. But we want to do it thoughtfully. We want to do it certainly with the regulation actually in hand. We want to do it after due consideration. But remembering, again, the key message is just to stay home. We will work around the edges to deal with some of these other important questions that are on the minds of people and certainly that are asked of us, but we will do that once we've seen the regulations. But remembering that if people would just opt and default always, not just today when it's not yet clear, but tomorrow and the day after that and the day after that, opt to stay home. If there's any doubt in their minds, then that will go a long way to actually dealing with the COVID situation.
Okay, thank you. Final question is to David Ryder from the Toronto Star. Dave, go ahead.
Hi, both. My question, I guess, is for whoever wants to field it, and that's given that Toronto saw some early success with tamping down this virus through, I think, June. And then since then, we've seen the numbers rise and then dramatically escalate in the last couple of months. And nothing you've done or said seems to have stopped that. From what you know of the new regulations, is there anything you can point to that will actually reduce virus levels in Toronto?
So, David, I think the simple answer to that is the more we are able to keep distance from each other, the more we are able to stay home, the more we will be able to reduce virus spread in the city. I think it's that simple. So, we can't say it enough. Please stay home as much as possible, right? Unless it's absolutely necessary, stay home.
Okay, I don't want this to be my second question,
we have a
but
pretty simple proposition.
Sorry, hang on one
David,
sec,
we have a
Mayor's
pretty
just going to
simple,
address your question.
we have a pretty simple proposition here. If the stay-home order is as described, and we haven't seen it yet, but if it's as described and it requires and kind of sets some very careful parameters, which is what we're seeking to determine about people staying home, and then if people actually do it, but that's no different than what we have been saying, I think, and I don't know whether we've been not finding the right words or not using some of the words that we needed to apply emphasis, but we've been saying that for a long time. If people stayed home and kept their distance and wore a mask and washed their hands, I say this in my sleep, I think, now, because it is so important, and the really key is for people to buy in, I think, more so than even the words of the order itself when they come. I think that's even more important. If people just buy in, the remainder of those who haven't. Many people have. There are still too many, I believe, who are rationalizing it and saying, well, I'm really effectively staying home except for the times I didn't. And those are really excusable because. And I think we just have to sort of say, no, staying home means staying home, and that's the default position.
Okay, thank you. My follow-up is, I hear the frustration about the fact that tens of thousands of people went out shopping in Toronto, but the fact is Walmarts and other stores were open and allowed to sell toys and home furnishings and all sorts of non-essentials. So I guess my question is, doesn't the city and the province bear blame for that? And I guess the follow-up to that, is there anything Toronto's looking at doing above and beyond what the province has ordered?
So I think you've heard us mention a few times here now that clearly we need to look at the regulations as they're being proposed. We look forward to seeing them later this afternoon. And as far as we're concerned, if I can speak for all of us here, steps that actually move us in the direction of increasing distance between people, steps that actually allow for the circumstances so people are more likely to stay home as much as possible. I think any steps in those directions are exactly the kinds of things that we need to take on. Again, the greater the distance, the more we are able to put distance between ourselves and others, in particular the people that we don't live with, the better off we will be in terms of controlling virus spread. I know that it's a difficult proposition. People are tired of hearing it, but it is incredibly powerful. And at the end of the day, it works. We know it works. We've actually seen it work here, and we've seen it work in jurisdictions all around the world. So again, we just can't emphasize enough, stay home. Stay home as much as possible. And as the mayor said, do it today, tomorrow, and the day after that. And eventually, we will get beyond this. We will get to better days. It's going to be tough, and I think we should be really, honest with ourselves about that. But it is what's necessary.
Okay, thank you very much for joining us, everybody. That concludes today's briefing. Please stay well, and of course, please stay home.